us to present today. And I would like to acknowledge the country that I am on, which is the Wurundjeri lands of the Kulin Nation. So that's in Melbourne here. I also want to, give a caveat that I'm actually an early career researcher, and I don't have a lot of experience in, ethics for mature minor consent. This is new to me. So I've been at this for a little while now, but my previous research experience has all been in under sixes, so a very different approach. So perhaps a better title for this presentation would be Assessing a Young Person's Ability, we've lost it again, to consent via social media, because that is indeed what we have done. I'd like to acknowledge the chief investigators on this project, all of whom are well known in their respective fields, and that this project has been funded by the Medical Research Future Fund. So what is LONGSTEP? Long triple P. LONGSTEP is the longitudinal study of teens with endometriosis, period, and pelvic pain. There are two components to LONGSTEP, and I'm going to talk about both of them a little bit. The first one was co-design, and this was conceived back in 2019 when the world didn't really know much about COVID and hadn't experienced a pandemic in some time. We thought that we would do a survey about periods for young people aged 12 to 18 years, and we thought that we would capture them in clinic when they came in to see a gynecologist. We also wanted to extend an invitation to them to attend a face-to-face focus group. Obviously, the landscape globally changed a lot at that time, and we had to seriously rethink that. In terms of the longitudinal study, that's something that we've started this year. It's an observational study. Similar to co-design, we're recruiting young people across Australia. For this, we've actually dropped the age range. So we've taken that down to 10. And that's partly because people in co-design were telling us that their periods were often starting at around 8 to 10. And so we thought that we needed to take this information going forward and change it. We will be looking at tracking periods, period and pelvic pain, quality of life, and mental health. And we're studying the gynecological care that's been provided to this cohort. So that might be whether or not they've been given a medication, whether or not they've had a laparoscopy, whether or not they've had excision of endometriosis. We're looking at their health utilisation, and we have data linkage to MBS and PBS. So you can see when the two studies are side by side, co-design and the longitudinal study differ quite significantly in terms of the participants' involvement. So why did we need to think about mature minor consent and doing it via social media for co-design? We had reached 2021. We hadn't really made a start, and we'd hit lockdown 6 in Melbourne. So a virtual option for consent became a necessity because people weren't coming into outpatient clinics. In many cases, elective things were being postponed. And so our plan was impractical, and we had to think about a novel method. When you think about that age group, 12 to 18, what do a lot of them spend most of their time doing? And that's on social media. So what we put forward to ethics was the process of autonomous online consent with recruitment done via social media. Ethics had a few concerns, and that's rightly so. They wanted to know how we were going to be able to individually assess competency via social media. And they suggested an information statement and a quiz designed to validate and measure a maturer's maturity. The other suggestion was the Gillick competence test or Fraser competence test. And we looked into these, and we found that they weren't really suited to what we wanted to do. The Matura test took 23 minutes. Our period survey took 10 to 20 minutes. So we were going to be assessing competence for more time than we would be asking the questions that we had. And the GILIC competence test just wasn't going to work in an online setting for an anonymous survey. It was really much more about treatment, but we also thought that it needed a face-to-face assessment with preferably the clinician that knew them. So ideally, you would give them the PICF for what it's worth, and you would check their comprehension, and you might say to them, tell us in your words what you understand, and sort of a feedback process. What we actually thought when we sat back is, what do we really want? And we wanted them to be able to participate without having to ask for parental consent, because we knew when we were talking about young kids and periods that it can be a touchy topic, and they don't always want mum or dad involved. And so we put to ethics that the young person could consent to take part in this survey, and that no parental consent was needed. And we felt that this respected the autonomy of the young person to complete the survey that was related to their periods without mandating parent consent. So we encouraged them to discuss it with their parents, but it wasn't a requirement that the parents sign off on it. We asked a series of 7 questions, so they had to read the PICF that was embedded in the web page, and we asked 7 very quick questions, sort of true or false, to check that we felt that they understood what we were asking them to do. But we actually felt that if we'd gone down the pathway of requiring a parent's signature, that we might fail to engage the young people, and that would impact the integrity of the research, because then you've only got young people who will talk to their parents about their periods where they will both sign up together. Now, when we talked about the focus groups, we did ask for parental consent where the participant was less than 16 years of age, and that was because it was a much more in-depth discussion. We ran those via Zoom in the spirit of COVID, and we had separate young people and parental focus groups. So one of the other ethical considerations that has come up in both co-design and in the early days with the longitudinal study is when you're working with external organizations via social media. So you can give them your social media tiles, your social media copy, your Instagram or Twitter handles, and you can give them what ethics have approved, but sometimes they ad lib. And so you need to be very clear that when you are using, I guess, any external organization to share and promote your research, that this is the message and that the message is not distorted. And that also comes with promotion of research in mainstream news. And I know this isn't necessarily consent, but when you are letting journalists in and you are sharing information about your research, great as that is, you need to be really clear on your focus. And so these were some of the articles that we've had published. I think it was earlier this year. But for us, the message is simple, and you'll see that in the words that appear on the screen. It's period and pain. We believe that not everything that hurts is endometriosis, and that not all endometriosis hurts. And it's really about treating the pain regardless of what you can visibly see. But you need to be very clear on your message when you're working with mainstream news to make sure that that research is portrayed appropriately. So what outcomes did we have with co-design? We astounded ourselves. In the 6 weeks between September and October of 2021, we screened just under 2,400 participants. And of those, 1,811 were included in our survey. I was hoping for a couple of hundred, and at the time, anyone in Melbourne, we were silently watching the COVID numbers and the survey numbers, and we were trying to see if we could beat the COVID numbers for the day. which was interesting. But 1,811 participants. So of the sort of 500 that were filtered out, they either didn't pass on the competence test, or they were outside the age range or the location, so 12 to 18 and in Australia. We also ran 4 focus groups. We ended up having enough numbers to run 3 focus groups for young people, where they talked to a researcher and a medical student about their periods to get some ideas around what mattered to them, and was the survey representative of what they felt we needed to be looking at. And we additionally went back to ethics because we had a large number of parents that expressed an interest. And so we brought those parents together and offered them a group as well, where we talked in a similar manner. So shifting focus a little bit, I want to talk a bit more about engaging adolescents and their parent guardians in research, because I think this is crucial to getting the consent. This is the bit that comes before the consent. You need to know who your audience is, and our audience is unique and challenging because we've got young people aged 10 to 18 years, and we're running a longitudinal study, 5 years duration. So when you're writing a PICF and getting consent, you're covering 10 to 23 years of age, and there's a huge variation in their understanding, their ability to read. And we do have some strategies in place about re-consent at certain time points. We also need to consider that the parent guardian is the audience. It's important to know where they're at. When are they receiving education, and are they getting periods education in primary or secondary school? Because that's how we're picking some of them up to consent them for our study. A big thing for us has been what social media platforms that they're using and how they want to receive information. Outside of the education framework, where are they going for information? And a lot of them are going to TikTok. Now, TikTok promotes itself as being for 13 plus. I'm not sure how easy it is to get an account if you are under 13. And it's also a platform that as researchers, we don't really engage with, but that's where they want us. So when we asked our focus groups, well, where do you want to hear about periods? Where do you want to hear about research? That was what they came back with. I mentioned earlier that we use some external organisations to promote via social media. And one of those was Endometriosis Australia. Now, that was great, and we're very grateful to them for their support. But when you look at their membership, less than 1% of their members are under 18 years of age. And so that's where you're capturing the parent guardians, but you're not capturing the young people. And if you're not getting the right people in, I guess you need to have a look at where your study cohort lands. In terms of schools and consent, if their phone is locked up in a teacher's lockbox or whatnot, giving them a QR code in a school sex health talk to then sign up for this research project doesn't work because they don't have their phone there. And so you need to think about how you're going to get that consent form home with them. When you do it, you need to then think about it working on all mobile devices and test it again. And one of the big things we've found in our journey is allowing them to save and return. So you're capturing their interest at the outset, but you're also encouraging them to go and check something with a parent and come back. So you're treating them as a mature minor, but you're giving them the option of bringing the parent into that conversation and engaging them at that first contact. So this is what we've tried so far in terms of recruitment to get consent. We've tried mail outs, we've tried SMS, and we've tried phone calls. Mail outs don't work. We are wasting our time trying to get consent with mail outs. Posters in clinic don't work because most of our consults now are conducted via telehealth. In a news sense, we're capturing a lot of parents and a lot of grandparents, but we're not necessarily getting to the young people themselves. Our experience with capturing them via social media has been great last year, but with the takeover and it now being Meta, the algorithms have changed and we can't get them this year. We've tried, and in a 6-week campaign, we've pulled maybe 20 compared to the nearly 2,500 that we got the same time last year. There's a huge value in consumer advocacy groups, but you need to go to the right ones. YouTube has been helpful for us, and there's a government page called Endozone. So I just want to show you something now that we've done, and I'm hoping that this link works. But what we did is we've developed a cartoon video that is a supplement to the PICF. So it doesn't replace the PICF because it can't. But when we're looking at trying to capture the attention of this age range, we were thinking about how can we get their attention and how many minutes do we have to grab them for. So I'll just share the video with you now.
It's a longitudinal study of teens with endometriosis, period and pelvic pain. I know that you are probably already aware that many young women get period pain, but did you know that that number was as high as 90%? What we're really interested in is the 20% who get lots and lots of problems. Unfortunately, we don't know why some young people have only a little bit of pain and why some young people have lots of pain. We also want to better understand the effects on emotional well-being and mental health. So our research project LongStep is being run at the Murdoch Children's Research Institute. But to make this project work, we actually need your help. The LongStep project is open to all young people who are aged between 10 years and 18 years, who have a new referral to a gynaecologist, any gynaecologist, for their period pain and period problems. The 5-year project starts this year, 2022, and it's for you and your parents, no matter who you are or where you live. Taking part is simple. If you're interested, you can fill in the online form, and if you're eligible, one of our research team will contact you and provide more detailed information on the study for you to read. This is called the Participant Information and Consent Form, or PIC. Depending on how old you are or how old your child is, consent from a parent may be required for the young person to participate. And we also do need some input from parents as well. LongStep will collect information about you, the young person, and from your parent or guardian by sending out a set of questionnaires once a year for up to 5 years. If you enrol, we will collect some personal details and ask about your medical history for both you and your parent or guardian. For the young person, there are 2 sets of questions, one on periods, pain and quality of life, and another on your emotional well-being or mental health. For your parent or guardian, there is only 1 set of questions about your pain and quality of life. There's also the option of participating in some testing to measure how sensitive you are to pain. It's called pain-oriented sensitivity testing. We offer this in Melbourne, Sydney and Brisbane for young people and their female parents or guardians. This is optional. At all times, your information will be kept safe and secure, and you can leave LongStep at any time. We're hoping that LongStep will be one of a few steps, not too many, steps towards making young people's periods, pelvic pain and period pain much, much better.
Over to you, Courtney. You're all done. You're finished.
Mind me, it's just frozen for a moment.
That's all right. Courtney, would you care to wrap up roughly in the next minute or so, please?
That's fine. I'm just trying to get back to the slides. Here we go. I've got 1 slide left, I think, so we're making good time. So the lessons we've learned for LongStep: be curious, engage with your participants, and don't be afraid to try something and reframe it if the outcome isn't ideal. You need to think beyond the traditional paradigm for recruitment and for consent. It's got to be more than just consenting via a hospital waiting room, and fill the gaps, or at least have a plan as you go. We also need to think about study retention. And as Ian mentioned earlier, that consent doesn't cover necessarily the whole 5 years. We need to be thinking, particularly in this age group, about reconsent. Yeah, frozen again. So I'd now like to open up for any questions. And if you'd like any more information from us or about our study, I'll leave the following links up on the screen.
Thank you, Courtney. Really informative and particularly consistent talk. We could talk forever about Gaelic competency, and given that that's really in relation to interventions, and this isn't an intervention per se. So really, should we even be considering that sort of consent or sort of assent process when really young people should be able to give consent in relation to their own sort of bodily autonomy when it doesn't involve an intervention. We do have time for one question, or I will ask one question from the question and answer chat. Which one? Okay, so I believe that Facebook, Twitter, Instagram, and YouTube specify that users must be at least 13 years old. Therefore, does this limit the age group available to engage online? And did you receive consent from anyone outside Australia?
So it limits the advertising to that age group. It doesn't necessarily limit the age group that's there, because a lot of them lie about their age to get an account. And we certainly checked in terms of IP addresses, and we validated with postcode checks and states. So we would not have consented anyone outside of Australia, because we did have some systems in place to block that.
And I'll ask one more, because it's a really interesting question. Does a young person know they will be undergoing a competency test as part of the assessment?
Yes, they do. That's the first thing they hear. Yep.
Yeah, great. Courtney, I'm really sorry we've run out of time, but I really appreciate it. I think the sort of juxtaposition of relational autonomy to pediatric or younger people, not pediatric, but young persons, mature minor consent is so important in this space. So thank you very much to yourself and Sonia for